I am Dr. Chris DeRienzo, Duke University class of 2008 from both the School of Medicine and the Sanford School of Public Policy. I'm a practicing physician, and I serve as Senior Vice President and Chief Medical Officer of WakeMed Health and Hospitals right here in Raleigh, North Carolina. For anyone who works in healthcare, the past year has presented an unprecedented number of challenges, from personal protective equipment to figuring out what the right personal protective equipment is when those rules are changing on an hourly basis, to finding the right infection prevention guidelines within hospitals, long-term care centers, restaurants, schools, and in our own homes, on through today as the state and the nation try to walk through a vaccine rollout in as fast, as safe, and as equitable a manner as possible. These are all challenges that as a healthcare provider we face in our day-to-day life and practice, but they're also public policy challenges. Living and working here in Raleigh, I've had a first row seat to seeing our policymakers in action, working as hard as they can to try to get this right. And they need us, those who work in the field, to help them know what policies can actually be implemented, how we can operationalize and execute those in service of our people. I know our policymakers have been working incredibly hard to serve our community through the course of this pandemic. And as someone with a background in public policy, thanks to the Sanford School, it's been a privilege to get to partner with some of them in that process. It's a once-in-a-century challenge, and both those in practice and those who make the policies we put into practice have risen to that challenge. Again, I'm Chris DeRienzo, and this is why public policy matters.